Welcome, judges, friends, and family. My name is Morgan Yaloa, and I proudly stand before you today, hoping in some way that I can change your way of thinking. At this moment, if you would please open your mind to the story I'm about to tell. From the moment I opened my eyes, I asked myself if I can get out of bed today. As I lay there, stealing a few moments for myself, I searched my head for what has become familiar to me. There, in my temples, I feel the thunder roll in like the clouds before a storm. Finally, I find a ray of light in the dark to motivate me to get out of bed today. At first, each step sends another clap of thunder to my head before it fades to the background for the rest of the day. For the rest of the day, it's a struggle. I fight to stay awake, but my ray of light keeps me going most days. When I get home, I know that the struggle is over. I don't have to fight to interact with anybody anymore. I know at the end of the day, as I lay my head on my pillow, that it will be another struggle tomorrow. But that ray of light appears again and reminds me what I'm struggling for. Every day, I fight to be a normal person, even if I may not be one. I fight to be a part of society, to be a friend, and part of a family. My biggest fight is to be the voice of others like me and show that even though I live with this pain every day, that I will keep going. This is my fight. I am part of a community of people that live with chronic migraine, and we are people too. Today, I'm going to weave you a story. Throughout my story, we're going to visit many topics, and I'm hoping through these topics that I will change your way of thinking about people that live with chronic migraine. We'll start off with me educating you on what chronic migraine is and what happens during a migraine. From there, I will explain the stigma that surrounds chronic migraine and how people live with it on a day-to-day basis. I will have a small demonstration for you all today, and then I will conclude my project. Now, let's start the story. When you talk about migraines, first you have to ask yourself, what is the difference between migraines and just a headache? Migraines, by medical definition, are an intense throbbing headache that happens on one side of the head with multiple symptoms. For it to become chronic migraine, you must suffer from these 15 or more days in a month. Just like a bump on the knee or a bee sting, my pain is not your pain. Therefore, migraines are subjective to each and every person. This also means where, when, and why are all different depending on the person. Children can also get chronic migraine. By the age of 15, 5% of children suffer from chronic migraine. I will also refer to chronic migraine as CM as its abbreviation. My CM started when I was only 13 years old, and I've had it for the past 5 years. Now, 70% of children have an immediate family member that suffers from migraines. They can also inherit this family member's triggers. Identical twins have a greater chance of having migraines than any other siblings out there. Now, while there are different triggers, stress can also cause migraines, but it can also cause a temporary remission. I read a book that in it they had a doctor that talked about on September 11th, they expected a flood of phone calls from their patients with more serious migraines, when in fact, all of their patients had a temporary remission from it, and only 2 weeks later did their phone calls increase for patients. And while most doctors don't recommend caffeine for anybody that suffers from migraines, it can actually give them some relief. I used to drink a lot of energy drinks, and my doctor told me I could take them every two to three of them per week, when in fact, I only drank one maybe twice per month. going out and doing things can help somebody, but it can also make them worse. Please never assume that involving somebody in an activity will make them better. It can actually make them very, very worse. So please ask them before you just assume that they can go out and do things. Now I'll show you what happens during a migraine. Scientific studies have shown that migraines start in the brainstem in the central neuron in this section. From there, the pain travels to the peripheral neurons and cause blood vessels to dilate. This is an example of the blood vessel dilation. The nerves that run along these blood vessels become inflamed, which cause pain throughout the face, head, neck, and shoulders. Because there are major nerves in these places, that is why migraines have multiple symptoms. Now we're going to put our thinking caps on and do a little bit of migraine myth busting. The biggest myth is that migraines are just headaches, when in fact, headaches are a symptom of migraines, because migraine is a neurological disease classified by their flare-ups. Our second myth is that you cannot die from migraines. This is partially true. You cannot die from migraines, but you can die from complications related to migraines. People that live with CM are 3 times as more likely to commit suicide. This is due to the stress of having to live with pain every day and meds altering their moods or way of thinking. Our last myth is that migraines are all the same. Like I said earlier, my pain is not your pain. For example, if Kiana over here were to stub her toe, on a pain scale of 1 to 10, she might feel that is a 5. Whereas somebody like me who has lived with pain for many years might only classify that as a 2. Within the term migraine, migraines are very different. Some have auras, some can happen in the abdominal section of the body, and some can become chronic. These are 3 of the biggest myths that I wanted to bust with you today. Only some people that live with chronic migraine will get some of these symptoms and treatments. Not everyone who has CM will get all of these symptoms. Again, it always depends on the person. While a single migraine can be treated at home or with a single-day visit in the ER, chronic migraine requires a little bit more attention. This is because it is a type of chronic pain and can last longer than just 1 day. Treatment for chronic migraine include going to the overnight